Hi, thanks for joining us for another installment in our Implementing Simplify My Meds series. Now that you have identified patients for Simplify My Meds, it's time to get these patients enrolled in the program. Simplify My Meds is a voluntary program for your patients, so the first thing you want to do is have them sign a patient agreement. This is a non-binding agreement that explains what patients can expect with the program. Explain to the patient that all of their prescriptions will now come due on the same date each month, and while they are welcome to call the pharmacy with any questions, there is no need to call in refills. One trick you might want to adopt is that when you have identified a patient as a good candidate, clip one of these patient agreement forms to a prescription that they will be coming in to pick up. Your next step is to find out what medications the patient actually takes and which of these meds needs to be synchronized. Now, your technology solution will probably allow you to select the medications that you want synchronized easily. If you are running a manual program, you may want to go ahead and do a medication reconciliation to determine what medications the patient is currently taking. Synchronization may not be right for all medications. As needed medications, those with packaging restrictions, including insulin and eye drops, may not be right to synchronize. Make a note on all forms or in the notes function of your technology platform that the patient does take these additional medications. This will trigger you to ask if they need the prescription or over-the-counter items when you are getting ready to fill the patient's other prescriptions. The form should indicate a list of the medications, including the name and strength of the medication the patient takes on a monthly basis, including both prescription and over-the-counter medications. Now it's time to synchronize a patient's medications. Synchronization is the process where all the patient's refills are scheduled to come due on the same day every month. Your technology solution has algorithms that help you decide on the best synchronization date, but it's nice to be aware of the different methods out there. The most common way is to identify the medication with the highest copay or the most stringent dispensing regulation. This will become the anchor medication to which all of the other prescription medications are synchronized. In this case, it's Crestor, which is due on the 16th of the month. That becomes the patient's assigned pickup date. Next, calculate the quantity needed for each remaining medication to synchronize it with the anchor medication. Let's say that today is the 25th, and before synchronizing, the patient is requesting a refill on her fluoxetine. Since the fluoxetine is due after the anchor date, this patient will only need 22 fluoxetine tablets to become aligned for the 16th of the next month. Additionally, since the patient has already filled her lisinopril for 30 days on the 9th of this month, the patient would need an additional 8 lisinopril tablets to get to the 16th of next month. Contact the patient's prescriber by phone or using the physician fax form and request 2 prescriptions for each synchronized medication, one for the quantity required for synchronization and a second for the normal monthly quantity. When you are contacting prescribers, it's a good idea to explain the benefits to their practice as well. Use the customizable Simplify My Meds physician outreach letter and physician fax, or utilize your technology solution to explain the program benefits to them. Fewer calls to the physician by the pharmacy and/or the patient. The pharmacy will review entire patient profile and list of medications each month. The pharmacist will identify adherence-related medication issues and provide proper referrals. Document on the hard copy the one-time short fill was for an adherence program at the request of the patient, and be sure to assign a new prescription number to the refill. By the way, there are a couple of override codes available to you to assist in the billing of these short fills. Check out the Facts and Questions section in the Simplify My Meds Operations Manual for more information on this topic. Once you have done the initial synchronization, be sure to write the patient's name or patient identifier on a calendar and file all of their paperwork in the patient file. When you're ready, move on to the next clip 1 week prior to pickup.